It is time once again for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Dr. Meyer, happy Wednesday.
Hey, Dave.
Yeah.
Good morning. Let's be well. Who doesn't want to be well, right?
Yeah, exactly. Who doesn't want to get up and embrace the day? Well, today we're going to talk about autoimmunity. You've got another hope story, success story of somebody who's had a long-term battle.
Yeah, the gal comes from Esterville, and she is 30 years, been off to see the rheumatologist, and chronic inflammation, body aches, joint pain, neck, low back, that kind of thing. And it's always interesting how sometimes these things boil back down, as we were just talking, Dave, to the gut. And what we're introducing into our systems that seem to inflame the gut and that whole picture. But in her case, it's her body, as with anybody that's battling autoimmunity problems, you've lost self-tolerance. So what that means is that the body starts to attack itself, and it goes for the weak link. And sometimes that's based on genetic. There might be a genetic weak link. There might be a weak link that's associated with some kind of toxic exposure over the years that, maybe you were exposed to some, foreign pesticides working on the farm, that kind of thing, and now your lungs are the weak link. Well, once you have a leaky gut, which the majority of Americans have for a multitude of reasons, and in her case, it was gluten as a big contributor. That is just like poking holes in the digestive system and in that small intestine. And so when that is wide open, things are getting into your body and into your past the digestive tract, and the immune system is responding to it as if it's the enemy. And then you end up with the whole, gut on fire, brain on fire, whole body on fire type of picture. And so in her case, we started her off with some hyperbaric therapy because we always call that the great fire department, puts out all the fires. But if we can identify the other things that are leading to the fires in the body that are leading to inflammation, it helps everything we're trying to do from a support perspective, because the body naturally wants to heal itself if we give it the right conditions and we identify the things that are irritating it. And so it was pretty fun. She came in yesterday and had met with Molly, our wellness optimizer, functional nutritionist, and she wasn't so certain that she was going to be able to give up the gluten, and she ended up giving up dairy and sugar as well. And when she sat down with Molly, and so I was questioning on her follow-up how much progress she was going to have made, because she just had done 5 hyperbaric treatments. And she came in and just she's like, this is the best I have felt in years. And she shares with me, I decided I was going to cut out the gluten. Mm-hmm. And so she did it. And, the folks that have come here that have done that, there's not been one that has said, I regret that. Because it is a lifestyle change. It's a significant change, but it's been such a significant factor for so many folks that they feel so much better, and then the body can get into that health, that healing state. So, and that's where we're in the process now with her of supporting that digestive healing gut journey, where she's just going to continue to get less inflamed over time.
It's interesting sometimes the topics that we talk about, because just last night, Lene and I were having a discussion about Pepcid and Nexium when your gut's not feeling well. And I told her, I said, just like Dr. Meyer talks about, Pepcid and Nexium, those are Band-Aids. They potentially help you feel better. But that does not get to the root cause of your problem.
Right. And a lot of times, again, if you've got an ulcer, you've got some esophagitis or gastritis, most of like the Nexium studies, the proton pump inhibitors, which reduce stomach acid, those were short-term studies. There were never any long-term studies to see the effects of these things. So you see the over-the-counter stuff. It says, ask your physician if you're going to take it for longer than 2 to 4 weeks or something along those lines. Well, if you've got an ulcer, yeah, we want to reduce your stomach acid so that can heal up. But in the long term, yeah, these things, there's something else that is causing you to have those digestive symptoms in many cases. In many cases, it's not because you have too much stomach acid. It's actually the reverse. You don't have enough stomach acid. So those things may help with the symptoms, but long term what we're finding is, well, what was it that was triggering those digestive symptoms? In some cases, it's different foods, different triggers that are inflaming our digestive system, the gluten, other food products, other toxins and such. And if we can identify those and eliminate those, then we're not getting those symptoms and the gut is healing anyway. But long term, what we're finding is those PPIs decrease nitric oxide production, which is huge for heart health and blood supply to the brain and to the tissues. It's decreasing nutrients and vitamin absorption. It's been linked to dementia, these proton pump inhibitors. So the body is crying out saying, help, help, help. I'm inflamed. I'm out of balance. And we are just, in too many cases, 9 times out of 10, putting folks on these pills for the digestive symptoms that they may temporarily or long-term help the symptoms. But again, you're kind of robbing Peter to pay Paul because there's long-term consequences. You never figured out what was it that was triggering. What was it? And then, down the road, then that's when these things start to creep up. I use myself as an example. I used to take the pantoprazole for many years, and that's a heartburn pill, acid blocker. And guess what? Over time, I developed restless leg syndrome. So my legs were, bumping around. I couldn't keep them still, and I had to always move them. And twitchy legs. Well, why is that? It's because it was blocking the absorption of a lot of essential minerals and nutrients. Iron is huge. So you're having decreased iron absorption when you have on that medication. That leads to restless legs. Then, of course, I went on a restless legs pill to help that.
There you go.
So it's just, you just got to see how it goes. So.
Yep. So you're no different than anybody else out there, and we've all been through it, and all of a sudden the medicine cabinet, you get up in the morning and there's 8 prescriptions staring you in the face, and that's exactly what you're trying to help people not do. And certainly if people need to be on a prescription, you'll help them with that. But the idea is not to have 8 of them babies in your cupboard.
Absolutely. The idea is to use those prescriptions as a bridge when needed. But let's get to root cause. Let's find out what's going on and get the body healing, and so we don't have to be dependent on those pharmaceuticals.
Absolutely. All right. So if somebody wants to come over and see you or have a chat, a wellness visit, and say, "Man, Dr. Meyer, my story is so similar. For 10 years, I haven't felt well. I'd sure like to change that." What do they do?
Give us a call at 712-339-6024, and you can do a discovery call for free on Wednesdays. Wednesday afternoons I do those, just if you're kind of wanting to know how you might plug in, share with me a little bit about what's going on, and I can give you a little bit of better idea of a potential path forward. A lot of folks like to do that. And then, where you can stop in at any time if you wanted to at the clinic and see our amazing team. We're at 3305 Brookwest Avenue in Spirit Lake, just off Highway 71.
Very good. Dr. Meyer, it's always a treat. Have a great day, and we'll visit again next Wednesday.
All right. Be well, everybody. Take care.
Thank you, Doctor. Dr. Bradley Meyer of Okoboji Wellness Clinic. You can find out more, OkobojiWellnessClinic.com.